being here today and recording in progress and for supporting this training. And of course, thank you to ICCR for hosting us and to the Office on Violence Against Women for funding the FMI Training and Technical Assistance project. Given that this is a national webinar, I did want to make sure that folks knew about Tahereh, the organization that Bree and I both work for, in case you are working with someone in one of our service areas that may benefit from some legal services. And so we have offices in San Bruno, California, in Houston, Texas, Atlanta, Georgia, and our regional office covers Northern Virginia, DC, and Maryland. We have an office in Baltimore, Maryland, but also like a wide range of what's called the DMV. And so if you are working with someone who may benefit from legal services, you're welcome to reach out to us, and we have that number at the end. We work together in providing legal and social services in our interdisciplinary model. But Bree and I actually do a very different role, which is working with the Forced Marriage Initiative. Bree works directly as the case manager, victim advocate, liaison to every person who we work with, every client, every survivor, every person impacted. And we serve directly individuals of all ages and backgrounds. So really important for me to share that with you all, that you are aware that you can see us as a resource for training and technical assistance, and as well as direct case support. What brings us here today is that training and technical assistance, again, funded by the Office on Violence Against Women. And if you're not aware about our forced marriage project, in this slide, it gives you a better idea as to what brings us here today and why we may be a good partner for you all. We've been working on the issue of forced marriage in the United States since 2011. We have a combination of direct services, policy work, as well as providing training and technical assistance. In 2022, the Violence Against Women Act defined the Violence Against Women Act reauthorization defined forced marriage for the first time. And in doing so, really, I think made this issue more aware to service providers and understanding that it is a type of harm that is connected to domestic violence, sexual assault, stalking, dating violence, and at times even human trafficking. And so very happy to be here with you all to share about our work and to be a resource if you are ever looking for any support. Again, that could be direct case support, that could be a referral to our program, or perhaps thought partnership if you're working on a case. And if it expands beyond that, we are very happy to be of support on intake and assessment protocols. We've been doing that a lot, particularly with DV shelter providers on finding better ways of including forced marriage related questions on those intake and assessment protocols. And we're very happy to be of support to you all in that. So again, thank you for being here. We really appreciate your time, and we truly hope to have a great conversation with you all utilizing the chat. And so I want to recognize or acknowledge before we dive in that we know working in rural communities isn't a blanket term. We recognize that there are lots of different ways a community can identify as rural, and that the challenges could be similar, but depending on the resources, the access to resources, other factors, opportunities for support may range. We also want to acknowledge that many rural communities have an added influx of refugees, of new arrivals, or individuals who may truly benefit from specialized services. So we know there's not a one-size-fits-all approach to working with survivors or victims, individuals at risk of violence, and that is the same for those who are impacted by the issue of forced marriage. And with that said, we hope that this training can really help all of us sharpen the tools that we already have, and that we can continue to be creative while providing advocacy and support to those of us, excuse me, who we serve. I think we all recognize that, justice and help seeking looks different for all, and we just want to take that time to acknowledge that here. I know that at times we're using, terms or generalizing, and it's not, it may not be, a perfect use of language, but we hope that together we can use what we're learning today to continue and support those that we serve. And so let's get started with a little bit of discussion. I love to see in the chat, or for folks to utilize the chat to share what are some of the barriers that you are currently encountering when you're supporting victims, survivors, or individuals at risk. So I'll pause and see if folks can add that in the chat. Housing, funding, services, transportation, education, lack of financial resources. We're hearing that a lot as well. Mm. Programs being shut down because of funding, family support. Family support's a big one in situations involving forced marriage dynamics. Age. So it's in housing, childcare. Thank you. Thank you for joining the discussion. As we prepared for this training, we asked some of our colleagues that, the same question, and I don't think it's a surprise to any of you that we uncovered similar things. I highlighted isolation. As we know, isolation can be a tool, a tool used, in power and control dynamics. And under that, thinking about transportation, language access is something that also came up for us. And in some areas, the lack of culturally specific resources as folks are getting, more and more individuals being moved to their communities and not having additional culturally specific services. It also came up for us, the reality that there are communities within communities, and that impacts the ability to accessing services if they are available, but also how folks feel comfortable in accessing services. And often when we were, discussing this with our colleagues, particularly our social services team members, they share that often when they're working within rural communities, that the survivors they work with have shared that they are either, they are known to who they see as the helpers, or the helpers are individuals who are of maybe their same family or background or known to the perpetrator. And so there is a fear of what is confidentiality, something that you truly can provide, is something that has come up to in with those we work with. And thinking about those challenges, because those are not necessarily going to go away. I would love to hear from folks how you have been creative in addressing some of these barriers when you are working with individuals at risk. Mm, yeah. Genevieve, I saw you come on. Would you like to share some reflections on what you have seen as creative ways of addressing some of these barriers?
Sure. So 72% of Indiana is considered rural counties, so we certainly have our fair share. Some areas that maybe don't normally come up as considered services in this type of work have been very helpful. So examples for that is the McKinney-Vento Homeless Act. So every school district has a McKinney-Vento liaison, and their role is to reduce barriers to education for youth that are experiencing homelessness or housing instability, which sometimes folks ending up in the system or separated from their family for various reasons, that can be a big asset and resource. Also, another, I think, unsung hero can be the town trustee office. They can assist with everything from an overnight stay, sometimes transportation vouchers, formula diapers, just depending on what that need is there. So they've been a really great asset. Also, many rural areas still have a library pretty close by. And so you can have not only education that a library can provide, but internet access. Usually there's information on additional resources available around the library. And it also can be kind of a neutral, safe place to meet with somebody that maybe you're working with for safety planning or to kind of figure out what your options are. So those are really great. And then a couple areas that we did specifically in Indiana is our child multidisciplinary team. So that's tied in with our Department of Children's Services. So when those teams meet, we've had conversations with all of them to help them understand what child and forced marriage can look like, what that can do to the family, and what those resources are, as well as that legal framework. So that's been very helpful. And that flows over to places like our sexual assault treatment centers and our child advocacy centers, because those people are, on those teams. And so before we know it, we had just almost everybody kind of had the same language and understood that this was going on. And then, of course, language line. And also, if your agency doesn't specifically have a subscription to a service like language line, a lot of times the Child Advocacy Center or the Race Crisis Center, or the domestic violence shelters, or even libraries sometimes do have subscriptions. So that can help with your translation services sometimes.
Thank you so much, Genevieve. I know that was a lot at once, but I think it highlights the incredible work that folks working in rural communities are doing, and the reality that folks are, as Kelly mentioned, looking outside the box, trying everything possible to find a good referral, a good resource, and we always call that creative advocacy. But I think it's really important to bring that up here before we dive into the issue of forced marriage, because that is what we're doing day in and day out in this work, right? We're finding ways of being creative in our advocacy. If someone does not have, maybe access to phone, is there a safe place that potentially they could have access to a phone? I know of advocates starting, mobile advocacy units. I know of folks, hosting, office hours at, a local, as you mentioned, library, or you can think of a client that utilized the phone at the gas station to be able to connect to services, right? And so knowing who has a phone or who has stable internet and those things, and I think we all know that the need for that creative advocacy is needed, and it goes beyond our typical, I think, training of how we do this work, right? We do have to be very resourceful in with limited resources. Thank you, everyone, for participating, and again, Genevieve, for your reflections. I'd like to pass it now to my colleague Brianna to share more about the meats and potatoes of this training. And so let's get started with defining forced marriage. Pass it to you.
Yes, thank you. Thank you, everyone. Yeah, so we can get started with the definition that grounds us in the work that we do. So, forced marriage is defined as a marriage where one or both people do not or cannot consent to the marriage, and typically involves elements of force, fraud, or coercion. At Tahare, we don't equate the forced marriage to an arranged marriage process. An arranged marriage is one in which families may take the lead, but the ultimate choice to marry remains with that individual. And for those who are on the webinar today and who might interact with survivors directly, it's really important to understand the different terminologies that might be used from survivors in order to make sure that we are providing them compassionate support. So survivors may use a wide range of terms to describe their situation. They might not say that they're being forced at all. They might say that this is like an arranged marriage, one that they don't have consent to. Um, so it's just important to be mindful of the different terminologies that are being used, and that's okay. But once we have the knowledge of like what forced marriage is and what goes into it, then we can start asking the appropriate questions to ensure that survivors are not missing out on services that they might qualify for, and also that we're addressing their full trauma history. So when trying to identify a survivor, a critical piece that we're assessing is if they have free and full consent within the marriage. And consenting to a marriage is not always as straightforward as we might think. There's several different aspects of the marriage process that they are consenting to. So it's not just about the marriage itself, but it also includes the timing, the person, and other values that that person holds. So what we did, this graphic right here was provided to us by Vidya Suri. Who is a survivor and was attending Harvard at the time, and Direction Raja, who was at the Urban Institute at the time of this continuum. This graphic helps us understand how an arranged marriage process can turn into a forced marriage. And this is one where consent is key at all levels. So its ability to freely express their wishes, preferences, and potentially reject a proposal altogether without fear of harmful consequences. So the line between forced marriage and arranged marriage can blur, especially when there is force, fraud, or coercion, or other manipulation or fears that are involved. At times, we have seen cases where an individual did not mind and may have even initially consented to the arranged marriage process and having their family take the lead on a marriage process. But over time, or in the beginning, they were told that they could wait until after college, and they didn't have to get married right away. However, each family might have an incident where now the family is moving forward without that person's full consent. So this often looks like the family members pressuring an individual to get married right after high school and potentially miss out on the college education altogether. And then uh, forced marriage does not always occur in a linear way. They do tend to escalate pretty quickly, and a person can start off at stage one, where the family is suggesting a marriage, and due to, the incident or specific motivation, the family can move forward to stage 8 where they are being forced into a marriage. So it's just really critical to understand, the context and whether consent is involved um, when a survivor is reaching out for support. So now that we went over the definitions of forced marriage and consent, you might be wondering, why does forced marriage exist in the first place? And that answer is really complex, and it varies depending on the family and the individual family. Not everyone that we encounter, even if they're in the same community, has the same dynamics. So our beliefs, our traditions, the societal norms, and the society that we live in all play a role in deciding what's tolerated in one household, and what might be prohibited in another household. And the motivations in each and every case are varied. And is often intersectional. So what we did with this graphic right here is showcase that in every community and and society, there are different root causes. So, for example, this is patriarchal values, control over female sexuality, gender inequality, that are present across all cultures and all communities, that are just some of the reasons why forced marriage exists as a tool of power and control and oppression over a person. And then we relate it to the magnifying glass, where within there's individual family level triggers that act as this specific motivation for a forced marriage. So that could look like, dating in a household being prohibited. And sometimes, most often, we see is families discovering that their daughters have developed, platonic relationships or even romantic relationships with a person of the opposite sex. And because that is prohibited in their household, even if it's like the perceived romantic relationship, that could be a trigger for forced marriage. Because in order to like save their reputation, either of themselves, the family, and younger siblings' prospects of getting married as well. So all all really important. So as we move on to, just talking about consent again, um, it's just to ensure that it's clear for all. It's yes, I can freely express my wishes and opinions without negative consequences or fear. It's yes, I want to get married. Yes, I want to get married to this person. And yes, I want to get married right now or in the timeline that is discussed. And even if a marriage is happening in a legal way, it doesn't mean that consent was given. There might have been coercive tactics to get that consent, quote unquote. And so we should never assume that if a person is married, that consent was freely given. And some ways that a person can lack consent is the first one being subjected to force, fraud, or coercion. This can often look like family members threatening survivors of ending their own lives. It could also look like, threatening to cut them off financially. And we particularly see this case with younger individual who are college age, who might need their parents' tax returns in order to apply for FAFSA and go to school and other educational programs. And it could also be um, like sharing or threatening to share sexually intimate photos, even if it was a partner that they initially consented to. They are now using, coercive tactics to force them into a marriage, or a person that they've been forced into a marriage already and now getting them to remain. At times, we've also seen if a survivor has an intellectual disability, the family is using that disability to exploit them and force them into a marriage. Sometimes they might be intoxicated and they're, signing paperwork. They don't really know. And at times, we've also seen um, an individual is signing documents that are in a language that they do not understand and that they weren't giving proper interpretation as well. And yeah, and then the last one is, being younger than the legal age to marry. And I'll pass it over to my colleague Genevieve to talk a little bit more about child marriage in the United States.
Right. Thanks, Brianna. So I'm going to speak a little bit just from personal experience. As Brianna talked about, children, if you're under the age of 18, you can't enter into a contract such as marriage. You also can't sign a lease on an apartment. You can't open a bank account. Um, Given certain ages, you can't even go and apply for a job. So in my case, I unfortunately experienced familial trafficking. And then when I was 15, I was forced to marry my perpetrator so that he would evade prosecution. So it wasn't religious or cultural or anything. It was just a get out of jail free card for him. But what that happened is that basically disrupted my adolescent development, right? All of that changed. I did try to go to school in the beginning, but when I came home, I was often met with violence and jealousy and suspicion. My new partner was afraid that I would find somebody my own age and stray. And then I also didn't really relate with peers my age either. So there wasn't, the after school activities or hanging out with friends or any of the sort of things. I was just in this weird isolating space where I didn't really connect with the adults in my life, but I also didn't connect with people my own age. And it was just very isolating. I also had no idea of my rights. And even if I wanted to pursue getting out of that situation or getting divorced, I mean, to this day, I still have no idea where I would have gone to be able to do that. So child marriage really increases vulnerability. It really also isolates you not only from social and peer and educational opportunities, but it also isolates you from potential intervention from social services or other agencies. A lot of times folks are just like, this is just really weird. We don't really know what to do with it. And so that can prevent some people from reaching out and intervening. So to summarize there, not having autonomy, not being able to consent to what's happening to you, being confused, being threatened, being coerced. I know one of the big things in my situation was I was promised that I could pursue my education, which was true, but the consequences of continuing to do that were certainly not worth continuing to try to pursue that. So very isolating, especially in rural areas, where you're not running into a lot of people and not participating in a lot of things anyway. It's something that can hide very easily out in those areas.
Thank you so much, Genevieve, for your sharing of your um, own experience and as we move forward of the work that you are doing in this space. And so I'm going to pause to see if we have any questions. And I see not, just some support for Genevieve. Thank you all. And so forced marriage is, what we're here, to discuss. Now you have I hope, a better idea of what the definition is. So again, someone that is not able to provide that free and full consent. And even if, at times folks may, they think they have some sort of control, but they truly cannot express themselves without some sort of fear of some sort of repercussion, which is key, right? That person's assessment of risk is very critical. The very act of entering into a marriage that folks do not consent to implies a great deal of power and control imbalance. And so when you're thinking about someone that it was forced, when we're not asking about the onset of marriage, when we're not asking how a marriage came to be, as Brianna mentioned, we're missing a piece of the trauma history, and we're missing a piece of the puzzle that helps us to better be able to provide trauma-informed and truly holistic services. So forced marriage is truly a form of violence on its own, but we know that it is never happening on its own, right? We've been doing this work for 14 years, right? In the United States, that's been our focus. And we've seen that this type of harm is always happening side by side or alongside the more, I'd say, like mainstream forms of violence against women, right? With this knowledge, I hope that as service providers, you may be better able to support those who are impacted, because you likely are working or could be working or have worked with someone who was facing domestic violence, but also they were forced to marry, or maybe an assault and they were forced to marry as a child, or perhaps you work with adults and not minors, but you're working with an adult who is a survivor of child marriage, right? And this truly impacts their ability to work with you, their trust, how they are able to, move forward with the plans that we have, that we have to complete with those we serve. And so it's incredibly important to know that this intersection does happen. Likely someone who is forced to marry has experienced abuse to get them to comply to the marriage. We have the marriage itself, then again, by its very nature, implies power and control imbalance. And then we have the expectations within the marriage, right? The expectations to be, sexually intimate, the expectations to, have children, the loss of that bodily autonomy, inability to pursue education, even if you're told you're able to, right? But barriers put in place, or not necessarily having any support to continue your education or your career goals. And of course, that all leads to mental and physical health impacts. All of that is a whole training in itself, and we're happy to continue the conversation. But to ensure that everyone here is clear, if you're wondering, well, why am I here? Am I not? I don't think I'm working with this population. I would challenge that thought, because again, we often are working with folks, but if we're not asking about the onset of marriage, if we're not asking how their marriage came to be, if we're not asking those questions, then we truly don't know. And this quote on this slide by Debjani Roy, who was at Manavi, a South Asian serving, focused organization, uh, is one that spoke true to me when I joined Tahare 8 years ago, because I was an advocate at a shelter and also at a rape crisis center. And I never thought to ask about the onset of marriage. Even when someone named a sexual assault within their marriage, we never asked about like how that marriage came to be in the first place. And so the quote by that Johnny Roy goes, advocates speak to many women who are facing domestic violence, abuse, or sexual assault in their marriage. Only later does it emerge that the conditions upon which they may have been married were under duress and ultimately against their will. And that I think is true to my reflections when I think about those I've served in that domestic violence advocate capacity. And just we didn't ask, and now the more we asked and the more we're finding the connection with forced marriage and with the forms of abuse that we often are working with. So I'm going to move us ahead to talk about a little bit more about these intersections. Genevieve, you're welcome to join me anytime if you'd like. Uh, it, and and I'll just move us along so folks can think more about these intersections. And so, child abuse is an intersection that we are seeing often. It is rare that I am working with someone who has not named that either like as a child they knew that a marriage would be planned for them, or that they saw that happening within their family, or their father or uncle, they took the lead and made decisions for the family, so they knew that would happen to them almost. Some folks have even named it almost like a different type of grooming process. What we've seen in working with minors is that often they may not have evidence, but they know that something is going to happen because they know their family history. They know they're hearing their family talk about travel, or they're hearing about, you do have to get, married before you finish school and all of these things. And advocates often have a hard time trying to provide support. Sometimes our systems are not necessarily in place to help, a child that knows something is happening in the future. But that is a very unique moment of prevention that is rare for us, right? And so when working with individuals who are children or who have named child abuse, or we think there's child abuse, often we have to take together all of the coercive tactics that they're naming, and potentially that could amount to child abuse, right? Is there emotional abuse? Is there withholding of food? Is there withholding of education? Have they been physically harmed? Have they been manipulated? Is there any neglect? And taking those together potentially could lead to meeting child abuse definitions. But often it is up to us as advocates are working with that child to explain or paint the picture in a clear way for advocates that are working to prevent child abuse. Rape and sexual assault is both a cause and a consequence of forced marriage. It is a consequence because if you're entering into a relationship without consent, then I would say that the acts that occur in that relationship are also non-consensual. You never wanted that to be in the first place, and we hear from individuals at risk or impacted, I should say, that they felt they had no choice but to, consummate the marriage so that they would avoid other type of abuse. And so that's really important to think about. Again, when we're thinking about moments of prevention, if you're ever on a call with someone who says, I fear this will happen to me, they may not specifically name, I fear future sexual assault, but that is exactly what we're talking about when someone says, oh, my family's going to force me to marry, I need help. Well, how do we open those doors uh, to our services to be able to provide that person support? It is very rare that we're working with someone who knows that something is going to happen to them, but it has not happened yet. Uh, Rape and sexual assault could also be a consequence of um, uh, of a forced marriage, and by I'm sorry, a forced marriage um, could be a consequence, and by that I mean that for some families, the if someone is sexually assaulted, that person is going to be blamed. There's going to be that, you know, we call the victim blaming, and for some families, they want for others in the family or the community or the church to not know that this occurred. And the way that they see the quote unquote fixing the situation is by marrying that person who was assaulted. Sometimes that could even mean marrying the person who assaulted them and protecting that person. I've seen this in several cases. Maybe you're aware of cases that involve some pastors or deacons who married the individuals who they assaulted as children. And so we see this happening often. And so when you're working with someone, don't assume that contacting family is going to be what's best for them, especially if you're in that space of providing support to someone who is a survivor of sexual assault, because we could have a lot of thoughts as to why they're hiding um, the assault from family, but sometimes it could be because they know there's going to be some other type of punishment, or marriage used as a form of punishment. Genevieve, I can pass it to you now if you'd like to take over from here.
Sure. So female genital mutilation and cutting sometimes can be a precursor for marriage. So that's something that unfortunately we do see in the US. And victims may disclose other forms of abuse, but not as much this area because it is just so painful and embarrassing. I will say on a note to this, if you do have a child or someone who has experienced this, there are medical interventions that can help. And Medicaid and state insurance will often cover those. So I know that's something that comes up quite a bit. So just FYI for you guys for that. I'm going to talk a little bit about the intersections of forced marriage and human trafficking. This is something that as I moved, not just in the forced marriage space, but also in human trafficking space in general, and have worked on a lot of cases over the last several years, I've seen forced and child marriage come up quite a bit, surprisingly often. So some of those situations, what that looks like is overseas recruitment. So we may have individuals that go over to other countries or areas where there aren't very many opportunities, and they may convince somebody like, hey, you know what, come to America, it'll be your dream come true, we'll get married, we'll have a family, apple pie, everything's great. But unfortunately, once they get here, they're then trafficked. So their documents are taken, they're cut off from their support system, they're not able to communicate with folks back home, and then they're made to work either regular labor or forced sexual labor, and they're essentially trapped here. Forced criminality is also a big part of that. So they're committing crimes, they don't know their rights, they don't possibly even know where they are. So they can be very hesitant to reach out for help because they think that they are committing crimes and they are a perpetrator as well. Another area I see this is within prostitution and trafficking. You already have kind of that language a bit in prostitution, such as wives and wife-in-laws, and that hierarchy of the group of a pimp and then, his workers there. But what I've also seen is traffickers will force some of their girls to marry them, again, similar to my case, to avoid prosecution, right? Because it's much harder to get spouses to testify. So they will offer that. They will also offer that as an incentive, thus elevating them among the other victims in the area there. So they will continue to keep other girls in line. So those kind of some areas that I have seen. Also, girls who have been victims of familial trafficking sometimes will look at marriage as a means of escape from their situation. So if they are remaining in their home and they're still experiencing abuse and violence and possible trafficking, they may see somebody else as, if I marry this person, I can either leave my home situation early because I'm underage, or that will help me get out of this situation. But they find out that that person is aware of the violence and the vulnerabilities that they have, and are just planning on using to exploiting them further. So that's another area that we've seen as well. We talked to folks in our foster care system, our Department of Children's system, as well as our CASA, so advocates or guardian ad litems that are working with children. I see this come up sometimes of like, oh, this person wants to get married, and then somebody else will take care of them that will solve everything. But unfortunately, they're just setting them up for another area of vulnerability and potential exploitation. Oh, and then finally, we had a question about if men are involved in forced marriage. Yes, there is data that represents men, although females are disproportionately counted in that. They're a lot more common for females. But we do see men, and men also specifically it intersects with forced labor. So we have some men that men or boys that have been forced into marriages where then they work in the family business, but they're not actually paid for it. And it's not a choice that they want to participate in and they want to continue to participate in. So you may have them ask for resources of how to get out of that situation.
Thank you so much, Genevieve, and thank you to the person who brought up the question regarding men. Um, I should have clarified that we would be using gendered language through this presentation, but really this is an issue that can impact individuals of all backgrounds, of all ages, and yes, it can impact women, girls, men, and boys. I'll say that I've worked with individuals of all backgrounds and the situations involving, the loss of, bodily autonomy, the forced pregnancy, the having to maybe remain in the household or upholding of very rigid gender roles. I've seen that more often with those who are women and girls and almost like marriage really being used as a tool to uphold those strict, values that family may hold. With men and boys, I have also seen what Genevieve named, but more of a if you don't do this, then you'll lose the financial access that the family provides. So I actually have worked with several men who are from, say maybe pretty wealthy families, but the family believes is their time to then become the quote unquote man of the house and take over the business. And the best way of doing so, like you have to get married. And so we are seeing the dynamics be a little bit different, but certainly can see across genders the labor trafficking connection where someone is again forced to marry, paint this picture that's painted of it's going to be a great life, whether they are there's an immigration component or not, but then they are forced to work in the family business and they are not paid. They're forced to work long hours. In situations where things could feel or be a little bit trickier, but still be trafficking, is when that labor is happening in the home, right? We used to call that about servile marriages. And so when that person is, you're forced to take care of children, you're forced to cook, you're forced to clean, you are, day in and day out, you don't necessarily get rest. And that can be a bit difficult for folks to, well, to see as well, are you, are you just, doing, housewife work, but really digging deeper on where is this person getting like rest? Where is their care? Like, who are they responsible for? And how did this happen? So we're seeing those situations intersect with trafficking and at times intersect with trafficking of individuals who do have a disability who are now forced to do this, household labor. Uh, and last but not least, we are seeing situations involving individuals from the LGBTQ plus community, where families utilize marriage as a way of, again, quote unquote, correct what they see as wrong, and marriage being used as a way of doing so. And so lots of intersections with marriage and various communities and various forms of violence, which again, I hope highlights for you all the importance of asking about the onset of marriage and the importance of, yes, listening to how survivors, how those impacted name their situation, and us being very creative in the resources that we point them to so that their needs can be met. Some individuals who intersect with, trafficking or domestic violence, or even, the crimes of stalking, they may want some of those, criminal penalties and that additional that support and criminalization. Uh, However, we work with many individuals who do not want that, who are already fearful of seeking services. They already blame themselves for not falling in line with what their family wants. And the thought of criminalization is very scary. And criminalizing their parents or naming their parents traffickers may not be what they want. However, some survivors do want that. Some survivors do want their experience to be named as a, family perpetrated trafficking. And so again, it's really important to take their lead, as my colleagues here have shared, um, even in situations where folks may not want the um, to be named as a victim of trafficking, that that those resources may be more flexible than the typical domestic or family violence resources. So it is important for us to note that and explore the resources that we have and explain that to folks. I think it's pretty clear how this issue intersects with domestic and family violence. We see the domestic and family violence happening both before someone marries. So again, your parents, your family members, those who you love and care for. And often we are seeing domestic violence happening from the person who you are married to and that family as well. Stalking in these cases can look a bit different because often we're seeing folks utilize what we say is that natural close proximity to then report or to, keep you in line, right? So if you are, a woman and you go to work, but it's like your family's, work, and you walk to this, to that store that you work at, and you always walk with your brother, right? It's not uncommon for your brother to always be with you, right? He walks you to work, he walks you back. Maybe you go to church with your with your family, and it's the same thing, right? You're using that close proximity and reporting back if you were on the phone, if you were late, if you didn't make it, whatever it may be, right? And so that's a little bit unique in the way that it can present in situations involving, forced marriage dynamics. And, I think stalking is already a difficult, crime to identify, and that close proximity makes it even more difficult in these sort of situations. One's situation, or one form of violence, I should say, that we're sometimes forgetting is the intersection with dating violence. And I think it is incredibly important to name this intersection because this can happen through whether it is a chosen partner, whether it is, a non-consensual partner, meaning someone that your family is asking you to date, forcing you to date because maybe it is someone who's respected in the community. Maybe it is someone, I can think of a case of someone whose family was uh, the young lady was from a family that did not have a lot of resources. They were, very, very poor. They were missing out on potentially going to be homeless. And actually, the church leader had a son who was not necessarily acting right, and they said, "Hey, if you were to, join our family, we would pay your rent. Your house, your family would not be homeless, right?" So that's, and again, a non-consensual partner. And then now this, like, the idea of, helping and saving the family is the pressure that this person had on their shoulders, like finally the ticket to get the family help and support. And so we're seeing those situations more often, and it could look like typical dating, but again, if we're not asking how that relationship came to be, we're missing that forced or that coercion that occurred. We're also seeing situations where the dating relationship is just, predatory, right? Someone who perhaps was in a position of power, again, a church leader, a coach, a mental health provider, the transporter for the youth, youth services, now dating one of those the youth that aged out of the program. And so folks who may be uh, picking on those or having their eye on someone who is going to be or who is more vulnerable. Okay. So I'm going to just take a quick look at the chat and see if there's anything um, if there's anything that has not been answered. I'm not seeing anything, so I'm going to move us ahead. So Bree, I
So,
saw the chat, but it's okay.
yeah.
I'm gonna go ahead and pass it to you for our screening and responding section. So make sure we have enough time to then get to all the Q&A. Let me pass it to you. And if folks, please feel free to add in the chat if there's more regarding these intersections that you'd like more information on by the time we get to our Q&A. Go ahead,
All
Bree.
right, thank you. So now that we went over how forced marriage intersects with other forms of abuse, I'm going to go over the warning signs and how to respond to survivors. So I'm going to start by exploring a few common warning signs that are often present within forced marriage cases. So one warning sign does not necessarily indicate that a forced marriage is present because these warning signs often overlap with other forms of gender-based violence. However, if multiple are present, then that should prompt you to start asking questions a little bit more in-depthly. And it's also important to, just recognize that these warning signs can happen to anybody, regardless of their community and the background, and we shouldn't limit it to people that we might perceive to be at risk of forced marriage. So a few things that I want to highlight, or one of the common ones that are pretty unique to forced marriage, is death of a parent. So we have seen when a parent is critically ill, they may force their child into a marriage as sort of a last wish before they pass, or maybe to ensure that that person is being taken care of as that parent is no longer there. We've also seen the death of a supportive parent also be a trigger for a forced marriage because they are no longer there to shield that individual from the family or the community pressures. One really big flag for us is fear of upcoming holidays, unsure if they're going to, return to the United States, or unsure if they're going to continue with their schoolwork and work. So at times, individuals may be taken overseas, often under false pretenses. They use the excuse that they're going on a family trip or they're going to visit a sick relative. But in reality, they are going for the purposes of to confirm an engagement or to actually hold a wedding ceremony or at least sign wedding documents. And this is usually without that person's knowledge and without their consent. So as we transition to, just discussing how or asking how someone is, forced into their marriage, it's really important that we, go over some key considerations to help guide us in our conversations and to make sure that we're asking, questions effectively. So, when we're supporting survivors of forced marriage, it's really important that we are open and curious and we're not coming from a confrontational manner. So we shouldn't let the fear of, being seen as culturally insensitive stop us from asking the right questions. And it's okay to acknowledge, what we don't know. So for me, I like to start off by, just explaining my role to the survivor, explaining what we can and can't help with. And we also, encourage people to center their voice when you're asking about, what has been helpful, what hasn't been helpful. Survivors are the expert of their own experience. They know, how their family is going to react to their attempts to avoid a forced marriage or help seeking. So if you're working with, someone with limited English proficiency, you should never involve family members or community members as interpreters, even if they're from the same religious or cultural background. It's really always safer to bring in a third-party professional. Shared identity doesn't always guarantee that they're going to be safe and that their information is not going to, go back out into the community, especially if that community is tight-knit. And the last point as well, we should not assume that colleagues that you're working with, even if they're from the same background, can and should intervene and provide support or will be helpful in a case that involves forced marriage. Again, it's best to get a third party involved. Genevieve, do you have any other considerations that you want to share with this group?
Yeah. So one of my biggest takeaways that I've learned over the years is having relationships and conversations with other members of your multidisciplinary team. So just starting with, that forced marriage is a thing, understanding what that looks like, and then identifying resources beforehand can be really helpful. So similar to forced marriage and trafficking, one of the biggest intersections is with domestic violence. And oftentimes because somebody reaches to the point where they're concerned that they will lose their life, right? Things have gotten that bad. And so sometimes you may have somebody that is at that point in crisis. So you need to move very quickly. But also note, in the case of children, when you have minors that are looking at possible forced marriage or they think that they might have forced marriage, there's a couple other considerations in there. First is if the family has international ties. I know we see movies where good-looking folks go and rescue people in other countries and bring them home and is happily ever after. Unfortunately, it doesn't really work that way in real life. And so it can be incredibly difficult, if not impossible, to recover a child that's been taken overseas. So once they're out of the country, really, really difficult there. So understanding that, so that might look like if Department of Children's Services decides to intervene and remove that child, to go ahead and make sure that you secure their passport and those documents as well. We have had cases just because being taken from your family is really scary. That's really, really frightening. And so the child might be like, okay, this is much scarier than what I was seeing, and run back to family. And family has unfortunately, gotten them on a plane and out of the country before maybe folks realize that they're missing. Another area too is that you may have a teenager that says, my parents are going to kill me, which is not an uncommon phrase coming from a teenager. However, we do know that honor-based violence is a very real thing. And so really listen to that teenager, that they're not being overdramatic, that there might actually really be a concern for extensive violence there. Finally, one of the things that we do here is sometimes there can be a bit of a misalignment between law enforcement and service providers that can make a big difference on the outcomes of cases and how we handle situations. Especially in smaller rural communities. So for example, we have had cases where the victims were related to people that are part of the law enforcement team that's investigating and responding, or part of the Department of Children's Service folks that are investigating. That can cause some issues, but it also can be helpful, right? It can either, you can have a person that's like, no, I know this family, this isn't going on, we shouldn't believe this person, or it can add credibility and legitimacy to it. But just really approaching that with a blank slate of letting, the person that you're working with, share their truth, their story, what their perspective is before making assumptions can be really helpful. Another area there is we are mandatory reporters. Many of us in almost every state, you are required to report to the Department of Children's Services. However, if you're able to make that call earlier in the day, and you have these cases that are a little more complicated and nuanced, if you're able to make that call earlier in the day, the odds of it being routed to an appropriate staff member with Department of Children's Services that maybe has some experience in this or understands what that upline is for help and resources rather than kind of the person on call or it being, from this person and they called in and, it just lands wherever it lands. So that has been something that's really made a big difference. Also, if you call the child abuse hotline, you can put a note in there to either call the advocate that's working with the child or the law enforcement officer if there's law enforcement involved before you go and talk to the family. And that way they can kind of give you an idea of like, hey, we think this child's actually living with their perpetrators. Um, this is kind of some of the background here. They have family here that we're concerned about, and they can you can do a little bit of prepping before you go in there.
Yeah, yes, thank you for going over, how to work with minors. I think just touching a little bit more on minors. One thing that I want to just bring up is even if you're not working directly with minors, you might be working with somebody who is a survivor of child marriage and or an adult who has experienced abuse related to forced marriage when they were a child. And these long-term impacts of child marriage often follow survivors into adulthood, and it really makes the recovery and the independence and self-sufficiency a little bit more difficult. So we work with a lot of survivors who have been married as children, and they often face a lot more greater challenges, trusting advocates, living independently, even when they transition into adulthood. Many of them were pulled out of school early, they missed out on education, they might have been forced to, have children at a really young age and been really financially dependent on parents and then spouses. And now they're struggling to, they're stuck in a cycle of potential poverty. They have health complications as well. So it's just really important to, just give them grace and just recognize that some of them might have never, taken a bus or done like simple tasks that we might, think are easy. So it really takes a lot of, courage and trust and working with them for support. So I want to move on to, how to ask in a way that's safe and respectful. If you are concerned that you might be working with somebody who is at risk for a forced marriage, it's really important just to be mindful of your biases. We don't want to unintentionally cause more harm or reinforce any negative stereotypes that can, really influence how we ask the person or make assumptions based on their responses. Forced marriage can happen to anybody, even in our backyard, and to people who don't have immigration related ties. So it's really important that if you're going to ask, we ask everybody. And just being mindful that if you're going to directly ask if you are you being forced to marry, that may not lead to the disclosure that you're wanting. Some individuals might feel uncomfortable. Some individuals might think that this is a private family matter and don't want to share it. And some of them might not see themselves as being a survivor of forced marriage. So it's instead, you might want to use open-ended conversational questions. And we have some right on the screen. So, how has marriage worked? How has marriage taken place in your family, community in the past? How do you feel about that for yourself? Do you feel that you have a choice in deciding who you will marry? How has your marriage partner been selected? Who is involved? And are you being pressured to marry someone that you don't want to marry or you're not sure about? And this approach will just allow us to assess whether there are elements of force, fraud, or coercion without directly asking them, are they being forced into a marriage? That might be a little bit more intrusive. So just finding a natural way is key. And you guys can take these questions, you could jot it down and start implementing it in your intake and assessment. I'll pass it to Elise now.
Yeah, thank you so much, Bree. Now, just to stay here a little longer, I'd love for folks to use the chat if you think there are ways of that you could implement some of these questions in your own intake or assessment processes as you think about the questions that are already asked. I believe we all or most of us ask about marriage in those processes, but we do not necessarily ask about how marriage came to be. And I think that is a really wonderful question when we think about like being able to uncover if someone is facing or has faced a forced marriage. And also incredibly helpful for folks who are maybe on the hotline to think about when you have someone on that calls and maybe often they're not saying on on that call, I am being forced to marry and I fear domestic and violence and sexual assault. That's not what you're going to get on the call, right? We may get that honestly because we're called the Forced Marriage Initiative. Like it's people are pretty clear, who they're calling when they're contacting us, but when they're calling their local provider or meeting with someone, they may be naming that they're unsure about a trip that's being planned, or they may not seem so happy about an engagement, or maybe you work in, maybe you're a refugee services provider and you are actively working with a family, and out of nowhere, the woman or the girl you're working with is now engaged, right? These are things that we know, there's something here, but are we asking, right? And so asking really is key. And then also asking about their perception of risk is really important because they may not have what we or our systems may need to be considered evidence, but there's a reason why they fear, and digging deeper may help us to better make those connections to child abuse, to domestic and family violence, maybe trafficking services, and so on. And so I'm going to leave us with this slide before I ask another, reflection question and hopefully have more dialogue together. But this slide came to be from many conversations with various individuals impacted, folks who named that often they interacted with service providers who did not help because they felt it was a cultural issue or they didn't feel they were the right person. And, when we make assumptions about culture, that leaves victims with, few options, right? We're all part of a culture, right? I could live in the same, town as, you all or some of you, and what's okay in your house is not okay in mine. The values are different and so on. So in thinking about this issue, it is never all families. It is never all families from a particular town, from a particular, background. The idea that that's just how things get done is never an excuse for folks to endure abuse, and culture is never an excuse for abuse. And this third bullet point, which was really, it was pulled from from a quote a client told us. They said that, I can love my culture, I can love my religion, I can love my family and community, and at the same time, I do not want this thing to happen to me. Some traditions do have an expiration date. Some expectations do have an expiration date. And I think that's really powerful, especially when we're working with someone who we may just feel uncomfortable, or we may feel we're not the right person. But that person is naming, hey, I'm from this community, I'm from this background, I'm from this culture. I don't want this to happen to me. And we should listen to that person as they are the authority of their own life and of their own background, of their own culture. And so I think that's really powerful for us to take with us, especially if we're working with individuals who are uh, maybe from communities who we think could be supported with or by other services. Be open. You don't know what you don't know, and that's okay. This training is not to now, make you an expert on this issue. This training is really for you to know that, this issue occurs. It occurs right here in the US. It occurs in the client cases, the loads, excuse me, that you have, and making these connections are incredibly important for individuals of all backgrounds. As Brianna mentioned, asking everyone, not just some people, about forced marriage is really important. As Genevieve mentioned, she is a survivor, and if we don't ask all, we may be overlooking in one area and underlooking in another area because we think we know what a victim is supposed to look like, or who are the folks who do this, and that's just not the case. Again, families are all complicated, and the motivations are uh, they vary, right? For some it's financial, for some is could be cultural, for others it could be religious, for some it truly may be a means to an end when it comes to childcare and financial and all of these things, and or being uh you know just families that do to perpetrate abuse. Uh, we should never allow the fear of being perceived as prejudice to keep us from actually acting. That is what leads us to having, that pause, that negative assumptions, perceptions. Again, if you don't know what we don't know, you could always just ask, what could be helpful? What has been helpful? To help me understand what you think would be best for you. I hear you saying that you're worried about this trip. Why, help me understand why that is, right? How has this happened, or what leads you to believe that this will happen to you, right? Those are some wonderful questions that you can always carry with you. And again, ask everyone so that you're not accidentally overlooking in one direction. In some spaces, especially when I'm working with service providers who provide support through refugee communities, we get into this conversation about mediation, and we get into this conversation about, oh, folks just don't, they just don't know that's illegal here. And again, that's not the case. We're talking about, things that occur right here in the US, and this interconnected ways that forced marriage is part of violence against women, domestic violence, sexual assault, you name it. And so the idea that families just need mediation is, I think, a very outdated one. Now, families or those at risk could be supported by having more folks, like, having their eye on that family or on that child that fears future harm or future travel. But acting as a mediator, assuming that that is what the family needs, without truly understanding, well, why is it that this is happening? What is the trigger for this family? That is just not appropriate. And so I want to pause for a second and see if my colleagues, Brianna or Genevieve, want to share anything before we go into this reflection question and then get into Q&A. Okay.
None for me.
Okay. All right. Well, we're going to get to a reflection question, so we're all going to chat anyways. And so, throughout this, we started with naming barriers. We started with naming some ways that we are creative in our advocacy and finding resources using the library. Genevieve mentioned multi-disciplinary teams. And I wanted to have some time to talk a little bit more about what could collaboration look like, or MOUs look like with local providers in your area, right? I know we're all from different places, but what does that look like? What is working in your area? What do you see as potentially needing some work on? One thing that I'll name that I learned from Genevieve is that multidisciplinary team, and essentially like every region having that multidisciplinary team, right? So it's not just one team that is supposed to then respond to the entire, state, but multiple folks who know about these issues and can be the go-tos, and then also provide that extra support when like relocations are needed and all of that. So that is a really great tool that I'll be taking in the teams and community service boards that I'm part of. But I love for folks to use the chat and let us know what do you think is working, or what could collaboration or MOUs look like to increase victim safety in your area? And Genevieve, as folks, I'm not seeing folks use the chat, but maybe folks are thinking about it. Maybe you can share a little bit about how you started your work with IDFAP and what that collaboration locally looked like to increase awareness about the issue of forced marriage, child marriage, and altogether just being a more connected community of service providers.
Sure. So I was drugging, kicking, and screaming a little bit, of just having that lived experience of forced marriage and child marriage. Um, Way back when, I thought that it was just me. I was the only person that this ever happened to. I didn't realize that, in a 20-year period, over 300,000 minors had entered into marriages. So clearly a much larger problem across the country. Specifically, I wanted to know what was happening in my state. So data, along with other areas, is often difficult to acquire. But I did hear from other service providers across the state that they were seeing cases of forced marriage and child marriage, and they weren't really sure what to do about it. And so that really just started that first collaborative effort. So it starts with conversations, it starts with identifying the problems, and then it looks at what resources do we have? What resources do we have that we can collaborate on, that we can either strengthen or partner with? So I'm going to back up a little bit and explain what a multidisciplinary team is, just in case anybody on the call doesn't know what that means. So that is different disciplines. The primary disciplines that I like to see at my MDT tables is going to be a victim advocate. It's going to be law enforcement. It's going to be a prosecutor. It's going to be somebody in healthcare. That's usually our SANE nurses, our sexual assault nurses. And then, of course, somebody from Department of Children's Services and somebody that represents either a domestic violence shelter or domestic violence culture coalition in that area. So those are kind of the different disciplines. Of course, you can add a little more to it. But if you are, working with cases individually, you'll want to take a look at the appropriateness of the people at that table, because you do have confidentiality. And of course, we don't want to compromise cases if we do have investigations going on. Yes, a lot of rural communities have hospital or clinic, and they are often really, really involved in a lot of community things. I want to say that's probably the folks that I'm working with the most right now. We're working on establishing protocols for people in the medical field to respond to human trafficking, child marriage, forced marriage cases. MOUs are great just because it really clarifies this is what your role is and this is how we can all work together, right? So a lot of times we know that we have services in our community. We don't necessarily know what that looks like. We don't know what the limitations are. Anybody that's ever worked under a grant, sometimes there can be weird limitations of like, yes, we can pay for housing or we can pay for this, but we can't pay for the transportation to get you to those services, right? And so having some different options there to be able to fill in those gaps. Some organizations might be difficult to get MOUs with. So for example, we work a lot with FBI. We have amazing victim specialists with the FBI. FBI is not going to sign an MOU with us, right? But we have a lot of organizations that do. So if you're not able to have specific MOUs signed, because I don't want people to get hung up on this, because sometimes this happens, but just having a general guide, if you have a collaborative effort, whether it's an MDT, a task force, a coalition, just a general guide of like, this is our purpose, this is what we're doing, this is what everybody's roles are based on discipline. It just offers clarity so people understand why they're at the table, why they're coming to the meetings, and why they're important. What is an MOU? An MOU is a memorandum of understanding. Sometimes there's a financial component if there's reimbursement, but a lot of times it really is just an agreement. So our main MOUs that we have with the IFAP program are with the Indiana State Police. So we have an agreement that if we get a call about a suspected human trafficking case, they're going to respond, they're going to investigate, they're going to work with us. If they do cover a victim and the victim needs services, we're able to provide those referrals. We also have an MOU with, actually it's an MOA, so memo of agreement. Pretty much the same thing, just a different letter after it, with the Department of Children's Services. And what that says is that they're going to participate in ongoing training regarding forced marriage, child marriage, trafficking, because, our children's services worker, there's a big turnover there. We constantly have people coming in and coming out. So we have an infrastructure there that we regularly train, and we're able to get a lot of the new people coming in so that everybody has the same information. So that's just kind of some examples of what that might look like. It's just very clear. It assigns roles. It gives everybody clarity of what they're doing.
I think we both are reading the chat, right? I'm seeing folks
Yeah.
name having MOUs with school districts. I love that. Also want to highlight the um, what Annie mentioned. So thinking about resources to childcare providers, religious communities, community centers, and so on. The training for folks at the library, if they're worried about someone's safety, especially if that is the place, right, that folks are able to access resources. I love that. And I think the what my conversation with Genevieve has led me to think about is really one thing is to be known to that service provider. One thing is to have actual like a regular meeting and some agreement of if you see this, here's what you will do, or here's our steps, right? Or here's what I will do. And that has been incredibly helpful in working in situations that do have, I can think of cases I've worked actually in Indiana that have had some wonderful collaboration where folks are taking the potential travel of a minor very seriously, and really we're going to provide safety first. We're going to take passports away first. We're going to keep this person in the school district first, and then we're going to do everything else because of these conversations, these interdisciplinary meetings, and then also having those go-to folks that you can count on. I will name here the second question because I think that's also really important, which is what could collaboration look like, or what could a memorandum of understanding or agreements with agencies that are similar to yours, but perhaps are in larger cities that could provide the needed services that you are often seeing come up more and more. I like that question. It stemmed from conversations with my colleagues because it does open the door for potential to the resources, right? Especially if you're noticing, man, and we're often needing, I don't know, X, and is there an organization in a larger city that potentially could provide that resource? Is there a national organization that is funded to actually provide that service, but maybe we're not tapped into that, right? And so often the answer is yes. I can think of free sign language interpretation. I can think of the Asian Pacific Islander Gender-Based Violence Institute, who is funded to provide support to create language access plans, or the National Network to End Domestic Violence, who is funded to provide some deeper technology safety planning for advocates, right? And so, or us, who are a national provider on the issue of forced marriage, right? And so that's those are the thoughts that come to my mind. Genevieve, what about you when you're thinking about this collaboration maybe with organizations that may have more resources? What has that looked like for you all?
Sure, absolutely. Well, there might be some limitations. So an example of that is Indiana Legal Services. They can provide assistance with legal things for evictions, for child support collection, for immigration status, for divorce, for possibly, challenging things on a credit report. They can't do criminal infractions, right? So if you have clients that have that, co-occurring crime or forced criminality that's part of their experience, Indiana Legal Services can't help with that. But we do have other organizations that are able to help with that. So that's just kind of an example of that. Also, just knowing the resources in your area. I like to say that in systems, we often have systems that are completely broken. We sometimes have systems that have, at the very least, some bottlenecks, right? It just doesn't necessarily work the way that we need it to, especially when we have cases that are incredibly personal, involve human beings, and are complex. However, relationships with other people, knowing who the people are at these other organizations and in these different disciplines, you talk to them, you may bump into them at the grocery store for some of us that live in rural areas, right? That often, just those relationships and being able to have that candor and that conversation will often override issues and systems. I can't emphasize that enough. Yeah.
Thank you so much, Genevieve. I'm going to to ensure we have time for Q&A, I'll just take us to our last slide, which I think speaks to what some folks have named in the chat that I was just typing. We see our role, or we do this work in thinking about prevention and thinking about healing, we do this work from a non-judgmental point of view about the person, about their family, about culture, about community. It is folks don't have to tell me about their lived experience. They don't have to share. I think when we do take a trauma-informed approach, when we take a non-judgmental point of view, and we keep that line of communication open, then we are folks are able to see us as someone that potentially they can trust, right? And so, why is it that you're asking? What is it that you're trying to do? Again, criminalization may not be what folks want. Not, going to shelter may not be what folks want. Leaving the home may not be what folks are interested in. And so, keeping that line of communication open and coming at this issue with a non-judgmental point of view is always going to be key. We would never tell, or I hope, a survivor of domestic violence who maybe went to shelter, who then left shelter and went back home, that they could never reach out to domestic violence services. And so we would not do that to someone who's facing this type of harm, someone you're working with, and you come up with a plan and then they backtrack. That's very normal. Backtracking, freezing, it is a trauma response. And, it is a loss that they are thinking about, a loss of their family, a loss of their community, a loss of maybe everything that they have ever known. And likely they have lived in a world where the world outside their family has been painted as a very scary place. And sometimes it really is, right? And so it is a true loss. And so for folks, we respect how much they trust us. We know that it's courageous to come forward and share. And at the same time, we never make assumptions as to what they want. Sometimes folks just want to keep a line of communication open and they're still living at home. And sometimes folks are just wanting to have that thought partnership. And eventually that could lead to something else. Asking the right questions is key. And again, we're here to be um, uh, of support, whether it is, again, direct case support, whether it's some thought partnership, that's for Bree and I, Genevieve as well, and or for intake and assessment. I plug that in again because I'm very excited for folks to maybe just ask and figure out better ways of asking. If you remember anything and maybe just, print this slide. Yeah, if you have, remember that folks have a right to say no to a marriage or a partner they do not want. You may be surprised as to how many people tell us, oh my gosh, no one's ever told me that in my entire life. No one's ever told me I had a choice. I have a choice to maybe leaving a partner. And no religion sanctions forced marriage. If you're working in communities where there is strong, maybe religious abuse, please let us know. We are happy to connect you with folks who are of, various faiths, who have this sort of training, who understand that consent is needed, and intercourse not being an obligation, and that rape and sexual assault can occur within a marriage is something that, again, you may be surprised by how many people tell us they have never heard that before. And it's just really powerful, especially if you're working with folks who are adults, but maybe they are survivors of forced child marriage, right? And they did not have, this sort of education or bodily autonomy education or rights information about their own rights and laws and all of those things. And so I know that we are at time, but I want to just double check with you, Lacey, if there's any questions that perhaps we have not answered, so we can get to that and capture that on the recording. And again, thank you to everyone who is staying with us. Please write us. If you can stay for a few more minutes, great. If you can't, then catch the last few minutes of the recording once that is sent to you. Lacey, is there anything?
Yeah, I don't think so. You kind of covered it. Someone had asked about how to support those who do not want to criminalize the people forcing them into these forced relationships. But I think you kind of covered that unless there was something else you wanted to add.
To clarify, so the question was how to work with someone who does not want criminalization?
Right. Yeah. How can we as caseworkers support those who don't want to criminalize the person that forced them
Mm,
into marriage?
yeah. So here's like a couple of things. So actually we only have a handful of states where forced marriage is defined in statute under like the criminal statutes, usually under trafficking statutes, and some of them are in this really like old language statutes tucked under like, forced to do, all these things, right? And so I'm naming that because forced marriage, as we're talking about this here, right, as advocates, we're seeing that it is a form of abuse. It may not necessarily be a crime where you are, right? Which is why it's so important to understand the connection with the crimes, right? Or with the other forms of abuse. And so I would come at this the same way that I hope you would support someone who is a survivor of domestic violence who is approaching you about their situation, right? We, as advocates, we never push someone into one thing or the other. However, we still explain about the rights and options, right? We explain about what potentially could happen if we take this path with maybe reporting to law enforcement. We explain about civil processes like orders of protection, right? And so I think it's really important to think about it in that way and to demystify that forced marriage is something that is so, so different. It's a form of abuse, right? And it is, connected to what we are often working with. But the reality is there if they are facing some sort of like physical abuse, battery, a crime, we have to explain what that process looks like, right? Just as we would to anybody else who's facing some other type of abuse. I will say it's rare that I've seen a client and I'm racking my brain thinking, and I'm like, I can't, in 8 years, I can think of maybe one who has asked for support in criminalizing or like of their parents, and that was someone that they named their situation as like family perpetrated trafficking, and they want support with what happened to them. What I've seen more often is folks who are wanting the person they were married to, and then that violence that happened within the marriage. I see that more often, which is again is the typical and I hate to say typical, but I hope folks understand is like that domestic violence, family violence work that we are used to. Yeah.
Yeah. Well, thank you so much, guys. Y'all did a wonderful job. I know I learned a lot. We're getting a lot of great comments in the chat. So thank you so much for being here today. Just a quick reminder, I wanted to share lastly about our summit we have coming up September 22nd and 23rd at South Padre Island. Use the QR code there to check that out, or you can go to conferencecaw.org. Also today, after we conclude today's webinar, you'll be receiving an email or yeah, I can't talk. Your survey will pop up. And once you complete the survey, you will gain access to your certificate to print out for your attendance today. And this will be available along with the slides on our website as well. So anyone last minute, thank you for being here. And let us know, reach out if y'all have any questions. Thanks so much, guys. Bye.